अस्सलामुअलैकुम एंड वेलकम टू अनदर एपिसोड ऑफ मेडकास्ट। मैं हूं आपकी होस्ट समाहन साल और आज मैं आपके साथ एक बहुत इंपॉर्टेंट इशू डिस्कस करने आई हूं। बल्कि शायद मुझे आपसे पहले पूछना चाहिए कि क्या कभी आपने बहुत ज़्यादा ज़हनी दबाव महसूस किया है? क्या कभी आपने बहुत स्ट्रेस सिचुएशन में अपने आप को अकेला महसूस किया है? क्या कभी आपका दिल किया है कि आप सुबह उठे ना, रात को सोए ना, दुनिया से अलहदा हो जाएं? ये सब मसले इम्पोर्टेंट हैं। हम सब जितनी केयर मेडिकल इश्यूज को देते हैं, जितना उनका इलाज करवाते हैं, उतना ही ज़रूरी इलाज मेंटल इश्यूज का भी है। इन सब मसलों को इग्नोर मत कीजिए और जाके डॉक्टर को दिखाइए। इन सब सवालात के जवाब देने के लिए आज हमारे पास हैं एक ऐसे डॉक्टर जिन्होंने बहुत अरसा बहुत लोगों की इन सब चीज़ों में मदद की है और ना सिर्फ पाकिस्तान में बल्कि पाकिस्तान के बाहर भी अपना नाम बनाया है। इन लोगों की इनकी ऑर्गेनाइजेशन जिसका नाम माइंड ऑर्गेनाइजेशन है, इसके थ्रू और वैसे भी अपने क्लिनिक के थ्रू इन्होंने बहुत लोगों के इस तरह की प्रॉब्लम्स को दूर किया है। इसलिए आज हम अपने शो पे उनको बहुत फखरिया इनवाइट करते हैं। We will have Dr. Saad Bashir on our show today. Assalamu alaikum, I am Samaha Nisar with another episode of Medcast. And today we have with us Dr. Saad Bashir Malik, who is a renowned name in the world of psychiatric medicine. Welcome to the show, sir.
Thank you. Thanks for having me.
He has done DMP, MRC, FRC, FCPS, and has a 34-year experience in serving and helping mental health issues. And he has been recognized nationally and internationally. Sir, thank you so much for giving us this time.
My pleasure.
Sir, I'll just start with the questions then. Sir, ऐसे देखा गया है हमारी population में कि 4% of the total medical issues जो है वो mental health issues हैं और 10% of the public जो हमारी है वो mild to moderate mental health issues से सफ़र कर रही है। तो आपके लिए mental health basically क्या होगी अगर आपको हम definition पूछें आपसे mental health की?
A few things when we talk about mental health as I look at it. One is the various mental disorders that people suffer from. Depression, anxiety, psychosis, drug addiction. This is basically what comes under mental disorders and mental health. But equally important is preventive mental health. Preventive mental health means teaching people various skills on how to handle life stresses, how to plan their lives, how to design their lives, how to handle negative emotions, how to, like anger, anxiety, how to handle marriages, how to handle problems with peers, how to cope with stress. All this comes under preventive mental health. So most of my life, 40 years, I have been treating patients with various mental illnesses. But for the last 5 years, my main emphasis is on teaching people on how not to become mentally ill. And it's very unfortunate that there are some very simple methods and skills that can be learned, which can make your life happier, more meaningful, more satisfying, which can make your relationships better. But sadly, we don't focus on that.
सर, ये जो बहुत ज़्यादा जो मेंटल हेल्थ इश्यूज मैंने पीछे जिक्र किया है उसमें सबसे ज़्यादा हाईलाइट है कि हमारे पास डिप्रेशन है, लेकिन डिप्रेशन की आइडेंटिफिकेशन और इसका डिफरेंशिएशन लो मूड से, एंजाइटी से और जो जनरल स्ट्रेस स्टेट से हमें बहुत मुश्किल लगता है आम तौर पे डेली बेसिस पे। तो वो हम कैसे कर सकते हैं डिप्रेसिव डिसऑर्डर और लो मूड के दरमियान डिफरेंस?
I think we have to understand that the word depression means two entirely different things. One meaning of the word depression is a transient low mood, which we all experience from time to time. There's nothing wrong with it. It is normal. It doesn't require any treatment and usually goes away maybe after a few hours or a day. So that's one meaning of the word depression. The other is when your depression meets the criteria of three things. Number one, it becomes excessively prolonged. It goes into weeks and months. Number two, it becomes very severe. It starts affecting your daily life. your sleep, your appetite, your work, your relationships, your self-care, all that is affected. And number three, when there is no cause behind depression, there's no reason to be depressed. So when depression meets these three criteria, duration is long, intensity is severe, and there's no cause, then we are dealing no longer with a normal depression, but a pathological depression called depressive disorder. And that should be immediately treated because it has serious complications which can end up in suicide.
सर तो इसके लिए ज़्यादा हमारे पास प्रोन कौन सी आप कहना चाहें कि ज़्यादातर जो ज़्यादातर लोग लो मूड में रहती हैं, ये ज़्यादातर अंडर स्ट्रेस रहते हैं, कौन ज़्यादा प्रोन है इसके लिए, कौन ज़्यादा किसको ज़्यादा होने का चांस है?
I think, are we talking about depressive disorder or the normal depression?
Depressive disorder के बारे में.
Right. पहली चीज तो genetic है. In many families, it has a genetic basis. So people who have depressive disorder in their siblings or in their parents or grandparents, they are more prone to it. Second is your personality. People who are sensitive, anxious, perfectionists, pessimistic, they are more prone to it. And number three, the degree of stress that you have to deal with. If the stress is manageable, then even with a genetic predisposition and having a sensitive personality, you still can manage. But if the stress becomes too much, then everything decompensates, and then you end up with a depressive disorder.
सर हम सबसे ज़्यादा कॉजेज़ क्या कहेंगे कि अगर हमें कोई कहे कि सब ज़्यादा चीज़ें क्या चीज़ें जो लाइफ में होती हैं जिसके बाद बंदा ज़्यादा डिप्रेसिव डिसऑर्डर की तरफ चला जाता है, तो उनके कॉजेज़ में एनवायरनमेंट और वो कितने हद तक रोल प्ले करती है?
I think it's something like diabetes. You can have a genetic predisposition, and if you take precautions in life, you may never become diabetic. But if you don't take precautions, you start eating the wrong food, you don't do exercise, then you develop it. The same is with depression. If you have a genetic predisposition and a personality profile that predisposes to it, then any life event is any major event that happens in your life, like death, like divorce, like failure, like separation, they can all trigger off a depressive response. And then there are certain seasons where you have a rise in depressive disorder. हमारे मुल्क में generally spring or autumn में depressive disorder बढ़ जाता है.
Yes, sir. सर अगर कोई बंदा इन चीज़ों से गुजरा है, लाइक कोई ट्रॉमेटिक इवेंट हुआ है, कोई टेंशन हुई है बहुत ज़्यादा उसकी लाइफ में, तो आपके अकॉर्डिंग पर्सनल और जो उनके इर्द गिर्द लोग हैं उनको क्या स्टेप्स लेने चाहिए कि वो इस डिप्रेशन या डिप्रेसिव डिसऑर्डर से बच जाएं?
देखें, अगर if somebody who is otherwise stable and normal, holding a job or going to college, and suddenly you notice that he's become slow, aloof, starts isolating himself or herself, doesn't want to meet anyone, doesn't take care of his personal hygiene, doesn't want to go to work or college, and talks about simple ideas like there's nothing to live for, there's sadness, gloominess, helplessness, hopelessness, and this goes on and on and on. I think if you notice that in your family or in your friends, you must immediately have them seen by a physician. And if the physician rules out any organic medical problem, then they must be seen by a psychiatrist. You should never ignore this profile of symptoms that I've said, and you should never say to these patients that be brave or be a man or pull yourself together. Depression kya cheez hoti hai? These are very, very harmful statements. And lastly, if anyone ever mentions thoughts about suicide, take that very, very seriously. People don't joke about it. When they talk about it, they actually do it. And one of the biggest guilt that a family can end up with is when a member in the family commits suicide. If you die by some other natural cause like stroke or a road traffic accident, after 2 to 3 weeks, the family adjusts to the loss. But in suicide, the guilt haunts them for a very long time.
Yes, sir. Sir, so other than seeing a psychiatrist, do you recommend any personal level management for this situation?
I think now there are two things. People who are depressed, for them, I would say, please reach out. If they have a good friend or they have somebody in the family they can trust, who can understand, they must share their feelings. They must talk about them. And depression, fortunately, is treatable, and they can and should get help. And as for the family, they must be very, very supportive. They should take out time, talk to them, reach out to them. They should not abandon them. They should not ridicule their symptoms. They should silently listen to what the patient is saying, accepting and validating what he's saying, rather than trying to confront him or sermonize. That doesn't help. और यहाँ एक और बात मैं seriously कहना चाहूँगा. Please don't say to these patients कि तुम्हारे अंदर ईमान की कमी है या तुम दूर हो गए हो मज़हब से. This does not help because they have already done everything possible. और इससे उनके अंदर एक और सेंस ऑफ गिल्ट होती है कि ये भी शायद हम गुनाहगार हैं जो हमें सजा मिल रही है. That's not very very fair to them.
जी सर, ये साइकियाट्रिस्ट को दिखाने पे अक्सर लोग इस टैबू पे चले जाते हैं कि शायद हम पागल हैं या लोग बातें करेंगे या खानदान वाले क्या कहेंगे, तो उसको इरेडिकेट करने के लिए हमें क्या क्या करना चाहिए अपने इर्द?
I think इसमें कुछ तो कसूर हमारी अपनी प्रोफेशन का है, because we have miserably failed to create confidence in the population. We have failed to be good role models for our students and for doctors in general. Situation आज से 30 साल पहले भी ऐसी थी, आज भी वैसी है. I think इसमें the best thing is to explain to them that these are specialists who deal with a different speciality. Like you have cardiologists, pulmonologists, gastroenterologists, neurologists. ये भी एक body का component है जिसको ये specialists deal करते हैं. And they are best equipped to cure the problem. सिर्फ ये I think हम सब डॉक्टर्स को भी चाहिए कि स्टिग्मा को खत्म करें कि सिर्फ पागल लोग डॉक्टर्स psychiatrists के पास जाते हैं. You need to visit any psychiatrist in his clinic and you will realize, at least in my clinic, 95% of people are there who are people like you and me. They just have stresses, everyday problems, marital problems, family problems, job problems, anxiety, depression. Hardly 5% are those whom you would call insane. Now, that's a pretty small number. And even they are treated. Fortunately, they are treated. You mustn't.
जो इस तरह के सारे केसेस होते हैं उनमें कितना % मेडिसिन का होता है रोल उनको ठीक करने के लिए और कितना % गाइडलाइन का होता है? क्योंकि हमारा ये मानता है कि साइकियाट्रिस्ट के पास जाएंगे, वो एंटी डिप्रेसेंट देगा, वो बहुत लंबे अरसे के लिए लेनी पड़ेगी और मसला सारा खराब होगा सही होने के बजाय. अक्सर लोग ऐसे सोचते हैं.
I think यहाँ पे मैं 2-3 बातें एज एजुकेशन कहना चाहूँगा. पहली बात तो ये है कि अगर तो आपका डिप्रेशन जेनेटिक है, बायोलॉजिकल है, then you definitely need medication. But in most cases, you just need one medicine. And these medicines are not addictive. Just like बहुत important है कि हर डिप्रेशन के मरीज को दवाई की ज़रूरत नहीं होती. बहुत से मरीजों को सिर्फ काउंसलिंग की ज़रूरत होती है. लेकिन अगर if a woman comes to me who is depressed because of her husband's attitude towards her, then giving her medicines is not going to cure the husband. Then you have to see the husband and the couple together. इसी तरह, if a teenage child is having problems because the parents are constantly fighting or they are creating a row every day at home and he or she is upset, There's no point treating this person with drugs. You treat the parents with counseling. We need to understand this.
Yes, sir. सर हमारी पर्सनल हैबिट्स का जैसे खाने पीने की हैबिट्स का और सोने का कितना ज्यादा रिलेशन होता है हमारी मेंटल हेल्थ के साथ, क्योंकि आजकल अक्सर लोगों की काफी अनहेल्दी है जनरल पॉपुलेशन हम जो देखें स्पेशली हमारे एज ग्रुप में, तो उसमें आप क्या कहेंगे पर्सनल हैबिट्स?
There's a very close relationship. You need 8 hours sleep in your age group, continuous satisfying sleep for 8 hours, which is in keeping with your circadian rhythm. You need a good balanced nutritional diet. You need good exercise. These 3 things are very important for mental health, because अगर आपकी नींद डिस्टर्ब है तो आप दिन में you will feel irritable, you will feel dysphoric, you will have issues in relating to people, you will not concentrate.
यस सर. सर पे डिप्रेशन का और ये डिप्रेसिव डिसऑर्डर जो आजकल यंग एडल्ट्स में और ओल्डर में भी है, उसका ड्रग एडिक्शन से आप क्या लिंक अप करना चाहेंगे?
It's a two-way phenomenon. When you are suffering from depressive disorder, and you don't know what it is, then you start finding relief in anything and everything. So then you start experimenting with drugs. You start taking cannabis, cocaine, amphetamines, and they do give a short-term relief because they lift your mood temporarily. So now you end up with 2 problems. You have depressive disorder, and now you also have drug addiction. And this only makes the problem worse. On the other hand, people who are drug addicts, they are more prone to depressive disorder because of their lifestyle, because of their addiction, because of their disturbed relationships, marriages, and their social deterioration. They are more likely to become depressed. So it's a two-way phenomenon. They are very closely related. People who are depressed and have drug addiction, their prognosis is bad. It's poorer compared to those who don't have drug addiction.
So this session has almost reached its end. And आज के सेशन में हमने डिप्रेशन के सिम्टम्स, कॉजेज और इसकी ट्रीटमेंट के बारे में डॉक्टर साद बशीर से पूछा. और आई होप इस सेशन को सुन के आप अपने पेशेंट्स को और अपने इर्द गिर्द अपनी फैमिली को इन सारी कंडीशन से सफ़र करते हुए बेटर मैनेज कर सकेंगे. नेक्स्ट वीक इसी डिस्कशन को हम आगे कंटिन्यू करेंगे और यही सारे साइड इफेक्ट्स और प्रॉब्लम्स ज़्यादा फोकस करके देखेंगे लॉकडाउन के ऊपर, जो कि आजकल जिस सिचुएशन से हम गुजर रहे हैं कोरोना पेंडेमिक के ऊपर. और आई होप आपको वो वाली वीडियो भी हेल्प करेगी. स्टे ट्यून्ड, subscribe our channel, like, comment and share the video for spreading the awareness and helping our cause to spread. Thank you so much.